What's up, everybody, and welcome back to the It Matters podcast. First and foremost, if you want to show your support, don't forget to subscribe to the Facebook page to stay updated with all the content coming up. Now I'd like to tell you something about my friends at Sneaks. Sneaks is basically all about sneakers. These guys are so passionate about the quality of their products and absolutely in love with sneakers. Each pair of them has its own story and personality. However, they believe that sneakers are often the ones who actually find us and not the other way around. And this is how their story started. Do you want to keep going? Choose sneaks and make the step. Thank you so much for tuning in. This is the second part of my discussion with Dr. Steven Sclan. If you didn't manage to listen to the first part, I highly encourage you to do so. Let's resume our conversation and make sure that you stay with us till the end.
People were not interested in creativity, that rather there was an emphasis on uniformity because people's careers were based on that, certain ways of thinking.
Right.
And this was how things were supposed to be, and so consequently alternative ways of thinking about problems and solutions were just rejected. And she was the first one who started to tell me about this, frankly. I have to give her credit. It was not me. It was, I kept thinking I did something wrong, or we did something wrong in terms of setting up the proposal, or in terms of presenting the proposal. And it was my wife who first, as the artist, who first said, no, you got to see this for what it really is.
Yeah.
So the creativity piece of it is really being squeezed out.
And you know what terrifies me basically is that we are living in an era where everyone can speak their mind, can be heard, and this thing of washing out creativity, intuition, and things that basically makes us stand out from the others is trying to be washed out globally and on everything, not only medicine.
That's right.
And this is quite a problem.
Yeah, as we were talking earlier, and I really do believe that at the bottom it's an economic issue. I really believe that. Because, in one form or another, I mean, it doesn't have to be a direct economic issue, but as I mentioned a minute ago, when she first started to venture into this and explain this to me, she used to tell me that people's careers were, based on looking at beta amyloid and senile plaques. They built their careers on it. They're not going to put their jobs at risk. I said, no, they're doctors. No. I mean, let's just say we had pretty, avid discussions about it. But over a period of time, I began to realize that she was right. That's exactly what's going on. And it isn't just in medicine. I'm completely in agreement with you. You'll see it across the board in various disciplines, that there seems to be this emphasis on uniformity of thought. In reality, there's an emphasis on uniformity of thought. There's lip service given to the variety of thought and to expressing yourself, but that doesn't go anywhere. What really at the bottom is at the bottom, what's really moving forward is the impetus on uniformity of thought, because that's what people are getting paid to do.
All right, and as we talked before, that this creativity in some points leads to some very interesting and new ideas, and this thing, I don't think that creativity plays a very important role on the short run,
Right.
And people nowadays are just focusing on the short run.
That's right.
Just for their, as we talked, just for that immediate feedback. So they get approval. They know they are moving in the right direction, or in the direction that they desire. And I really think that one of the things that is killing creativity is that is our our will for that immediate feedback in everything we do. I mean, if you have creativity, basically you think forward and think a bit ahead of your times, and to reach a goal by using creativity, it takes time and it takes patience. And I think this is one of the problems nowadays, that everyone wants results not today but yesterday.
Absolutely. As I mentioned to you, we had this one experience where, as a group, this was only a few years ago, we went into a meeting with some bankers and investors, and this was not for Alzheimer's but for MTBI, and they were interested in what we were proposing as an intervention, as a psychopharmacologic intervention, and therefore they were interested in the trial. But they wanted they wanted money back, and they wanted to start receiving their money back in 6 months. And I said, what are you talking about? It takes a year just to set up the trial. There's no way. And that was it. And
and game over.
Yeah. I mean, how could you really think? Not you or I. I mean, how could people really think that we're going to have any meaningful advances in medicine if we don't commit to the long term? And they don't have to understand. In a way, it's interesting. Now we're talking about it. It would be foolish to think that those guys could understand what we were actually talking about. I mean, just as if they were talking about whatever they talk about, their financial lingo, I wouldn't understand what they were talking about. But at some point, there has to be a common meeting, or there has to be trust.
Yeah.
Okay? There has to be some understanding that they, as investors, of course, they have their own priorities and their own needs, and that has to be dealt with in a constructive way. But similarly, we, as the medical researchers and doctors, we have our own set of loyalties and our own sphere of expertise, and there should be, as you said earlier, for the common good, a meeting ground so that we can get this worked out and move ahead. But it just seems that there is no longer that common ground.
Right.
There's just the demand, almost, and this is where my psychoanalytic training comes in, almost an infantile demand for immediate self-gratification, gratification, without understanding that some things gratification has to be postponed for a while in order to move ahead.
Right, and I think the problems of the investors in general is that they do not understand that medicine is not a field of profit, of making money. It's more of that, a field of consuming money for the greater good.
Yeah, and I don't think they get that. It's interesting that you say that. There is another colleague of mine in Spain who had been part of this group. He no longer is now. He had been part of this group. He has a small private clinic in Spain, and originally he started treating dementia, elderly and depressed and dementia patients. And he was forced to take on investors, and he's had to change his whole style as a doctor. He's had to change not only his style of operating, but the whole style of the clinic. He has a son. It's very interesting. He has a son who is an RN and a master's degree in nursing. And we were going to do a trial at his clinic. And we couldn't do it because of the requirements of the other guys who were running it. And I remember his son said to me, we were taking a walk, waiting for an answer. We were taking a walk on the grounds, and I remember his son said to me, he was the head nurse of the clinic, and he was he is. I say was, he's still on. He is a great nurse, and he's really a good person. And I remember we were talking about what might happen, and of course what ultimately did happen, which is that it was turned down. But he said to me, when business and medicine mix, it's never a good outcome for medicine. I've never forgotten that.
Right.
Yeah, when business and medicine mix, it's never a good outcome for medicine.
But you know what? That principle that you are mentioning happens also in business when stakeholders and people that are putting their money in their company are dictating the wages, the salaries, and the cutoffs of the employees that are really doing the work. Yeah, you know, it's the same principle.
Yeah. So this is what I meant when I said I think that this is a problem across the board now. I mean, there really is, not just in the U.S. but here as well. Here meaning in Europe. I think there's a slow growth of this washing out of intuition, of creative thinking across the board, especially in our sense in medicine. And it's obviously having its impact on individual people. That's for sure, on the health of individuals. I mean, as I said before, in the presentation, I mean, this thing with senile plaques and beta amyloid and all the derivatives associated with it as regards Alzheimer's disease has been ongoing since at least 1968, really before, but at least 1968. Right. And for all of the money that's been shoveled into it on both sides of the Atlantic, you can't say that anybody's been terribly positively affected by any of this. Now, people will, criticize and they'll defend it and say, well, look at cancer. Okay. I also might add, look at what happened with AIDS. When there was enough political pressure that was brought to bear, you got a lot of creative people focused on that disorder. And I mean, it's still an issue, but for those of us in Western culture, it's manageable now. I mean, you may not like it, and people may have problems with it, independent of medicine, but the reality is that it's manageable.
All right.
So it can be done. It can be done, but people have to be willing to really want to see changes and want to be willing to, do what needs to be done in order to get to that place. And in some cases, it may mean going against what everybody believes, being a little more creative, going against what 90% of the population or the group believes is really the right way to go.
Right.
You've got to be willing to stick your neck out, and nobody's doing that anymore. They're just not.
Yeah. I would like to ask you that, as from your experience in the medical field, and not only in medicine, we are, let's say, in the people-to-people business, right? Because we have to face people problems, we talk to people. And what do you think that those who work with people a lot, like not only medical staff, everyone working with people, what skills do you think they should put more emphasis on?
Myself, I mean, again, coming back to the very beginning of our interview.
I'm asking you that not only for your experience, but your emphasis on people, even in this interview.
Yeah, I really believe that I think the first quality is that the people who go into this really need to like working with people, into the field of medicine. I mean, and keeping in mind that there's a broad spectrum. I mean, I understand that there are, and I know enough, there are various personality characteristics that go into different specialties. And that's true. There's a whole field of psychiatry within medicine on that. But I think overall, I think for me, the most important is that we need to enjoy working with people on a very close one-to-one basis. And that means, frankly, you got to be willing to sit down and listen to your patient. And it doesn't matter whether we're talking about psychiatry or cardiology or frankly even surgery. I mean, I think that there's real value in the doctor, not just value, but import in the doctor being able to sit down and actually speak with the patient and interact with the patient around the area of concern, obviously.
Right.
But that part of it. One of the things that I'm experiencing now, and I didn't really talk to you about this at all. The other things that I do here in Europe, in addition to the clinical research, is evaluation of many of the soldiers, the U.S. military soldiers coming back from Iraq and Afghanistan for mild traumatic brain injury and for PTSD. So I'm saying that because one of the things that goes on now, as it does in a lot of other medical practices, is that the computer literally sits in between the patient and the doctor. And when the interview is being carried out, the doctor who's doing the interviewing is actually typing in the answers to the answers, but the clinical notes as he or she is interviewing the patient. And I don't do that. I can't do it, number one, because I'm not that good at it, Okay. But number two, I don't do it because obviously, having been trained for a couple of years as a psychoanalyst, it's like the worst thing in the world you could do. You got to look at your patient. You got to make eye contact as I make with you and you make with me. We look around, but we look at each other. We use our hands. There are a lot of things that go on in the interaction. And I think that ability to communicate is probably the most, not only, and there's a reason why I say that, is not only the most important thing. I think it's required. I can't tell you how many people have said to me, not only the guys who I evaluate, I don't have the computer, it's on the side. Not only the guys who I evaluate from the military who I've evaluated, but because I work with geriatric patients and their families, how many people have said they can't stand Dr. X or Dr. Y or Dr. Z, whatever the specialty is. She said, can you believe they'll tell me, can you believe they were actually typing into the computer when I was talking to them?
Right.
And telling them what I was, what was happening to me, or what was wrong with my heart, or what was wrong with my leg. They weren't listening to me.
Right.
Okay? Mm-hmm. So and that's really, really important, because so much of what goes on in our work has to do with the patient feeling that they've been heard and understood. And I'm not talking about the obvious psychiatric stuff. I mean, that's obvious.
Yeah, right.
Okay? I mean, I'm talking about physical complaints.
Yeah. But, to make matters worse, I think that this principle applies even to our everyday life, which is far worse than only talking about it in the medical field. We are with our friends, we are our family, we are around the table, everyone is, looking at their phones, typing at something. You say, okay, let's gather together to a table, just go out, and everyone, and if it's 3 seconds or 10 seconds, 1 minute of silence when someone goes to the bathroom or something, we just take our phones, pop it up, and just scroll something.
Well, you see what my phone is.
It's an old school phone.
But yes, I'm amazed sometimes when you go into restaurants or you go into movie theaters, or you go even on the planes. I mean, it's just astounding. It's absolutely astounding how couples got people out on dates. I mean, I said to my wife when I said, I don't understand this. How do these guys, meaning, no offense, meaning, people your age, how do these guys get to know each other? Because they go out for dinner and they're both like on their iPad and they're all screen doing this, I said, don't they talk to each other anymore?
Don't get me wrong. I do this myself when I'm alone. and with no one to talk, I just unlock my phone, listen to music, podcasts, everything I read. But I don't think that a phone can replace nice conversation. I mean, I do that when I'm bored by that person, that group. But if I'm really interested in talking to someone and finding something about them, or really want to pay attention to them because I'm interested, I'm certainly not doing this phone
Yeah,
thing.
I mean, it's beyond my comprehension. I mean, I don't get that. But I want to make the point, because that's why I'm here in Bucharest, and that's why we're talking. What people do in their personal lives, you and I have little control over at this point. Okay,
right.
But from the point of view of the medical profession, and how we deal with patients professionally and appropriately, I take great exception to the fact that there's a computer between the doctor and the patient. It really, really bothers me a great deal. And I think, but in fact, I'm an older guy at this point, and that's obviously part of, I guess, a generational issue. Because from what I understand, from again what I'm hearing is, again, more and more hospitals and insurance companies are actually going to be removing us from the equation,
Right.
and the patient will be sitting at the desk, can go into the internet, type in a few answers to a few program questions, and suddenly you're going to get the diagnosis.
Yeah.
I'm thinking, I don't even know how people can do this. I don't. I really don't. How can you do this without seeing your patient, without holding your patient's hand, without taking the pulse, without seeing the skin color? I don't get it.
All right.
I don't know what to say. I just don't know what to say.
I totally agree with you on this one.
So.
We have this phenomena here in Romania with that Dr. Google. Everyone is sometimes they go to the physician with just to confirm their diagnosis, or just for the medical prescriptions.
That's right.
I looked it up on Google, and I have that and that. I only need you to write it on a medical paper and give me a prescription and just go home.
And that's exactly. I mentioned I had prescribing privileges in New York at NYU, and people would come in towards the end of my stay in New York. People would come in and they would say, here are what my symptoms are. I think I know this is what I have. Can you write the prescription? I used to say to them, what do you think I went to school for? I mean, wait a minute. Sit down. We're going to talk. We're going to try and figure this out. What did I go to school for? So that's kind of where we're at, and it's very unfortunate, and I have some real problems with it. But on the other hand, coming back to what we were talking about a few minutes ago, it goes right along with this issue of washing out creativity in the process, because it's just all uniform. It's what evidence-based medicine says. It's what the insurance companies will reimburse for, and you can package it for the computer and the internet, and there you go.
All right.
So that's it.
Yeah. Now, leaving a bit aside this part of medicine and things like that, I'm interested in knowing more about yourself regarding your hobbies. Let's say, what hobbies do you have?
Not some of them, not many, but the ones I have probably wouldn't surprise you. I won't tell you the big one first, but first of all, as a kid growing up, and I still have this hobby to some degree. I was very much interested in the theater. This probably doesn't come as a surprise because it's very much connected to psychoanalysis. I actually wanted to go into the theater and be a director when I was a kid.
Nice.
I wanted to study theater. I had been very much involved in high school, in high school theater. And I wanted, and I actually, the guy who was, I went to a school where the guy who was in charge of the theater program in high school had gone to Yale School of Drama, which is a good place. And I wanted to go to Yale and study at the Yale School of Drama. Coming back to what we talked about earlier. So when I was applying, when I was beginning to think about applying to college, my mother and father, I had to obviously work with him. And I'll never forget this. I said to my father, I want to go to Yale, which he was, I said, yeah, I want to study theater. And he turned around and he looked at me and he said, I'm not paying for that. So when I remember this so clearly. I looked at his face, and of course I was old enough. At that point I was 16, 17 years old. I realized, he's not kidding around. I could tell by his face. He wasn't kidding around. He wasn't joking. So I realized I had to come up with something that was acceptable, to his sense of what I could, what I should do. Yeah. So theater became a hobby.
Okay.
And during a great deal of my years in New York, we went to the theater just about all the time. And not just Broadway theater, which was okay, but off-Broadway, and what's referred to as off-Broadway, and even off-Broadway, which means the less well-known plays.
I understand, right.
And the newer playwrights coming up. And so that was always a hobby of mine. I got to meet some, fairly interesting people. Interestingly enough, there was a very good friend of my father's. And now that I'm sitting here thinking about it, I often wonder if that's the reason why he reacted the way he did. There was a very good friend of my father's who had been a Broadway producer. He was a well-known Broadway producer. I don't want to drop any names, but he was. And I always thought that this particular guy would, if I pursued this, would be able to help me. But as I said, the story was, I'm not paying for that. So I realized, okay, I had to change. So that is one of my hobbies. Another hobby of mine, which is current and always has been, is I'm a very big cigar fan.
Okay.
I smoke cigars, not as much as I used to, but I'm always on search for great cigars in cigar stores. And that was one reason, I think you're aware in my background, because I think you saw some of my CV, we lived in Miami for a while.
I know.
And that was a great period of time for me because, seriously, it was a hobby. As you are probably aware, when Castro took over Cuba so many, many, many years ago, many of the families who owned land and had tobacco plantations left Cuba. Many of them went to America, to Miami, and many of them went to South America. And they started tobacco farms, tobacco plantations in South America. And it took a great deal of time, but by the time my wife and I moved down to Miami, those tobacco plantations were, and I think you can see now, I actually was a hobby. Those plantations were in fact producing cigar tobacco that was comparable to what the tobacco industry was before Castro took over. And many of them had family members in Miami who had the factories to actually make the tobacco, to make the cigars. And one of my hobbies was to get to know, which I did, many of those families.
Right.
So I actually got to know a couple of actual Cuban families. In fact, became very friendly with one of them who actually had relatives in South America, Nicaragua, who would send the tobacco up to America, to New York. I said to New York, to Miami, and they had factories and they would produce. They made the cigars there. So that was actually a big hobby of mine.
Yeah.
Not just getting to know these people, but to understand what went into making the cigars, and how shall I say this, enjoying them.
Yeah, what can I say? That's quite interesting and unusual. I mean, people referring to cigars as a hobby, and
Yeah,
yeah, you know,
I know.
there are a lot of people, and I know a lot of people that are smoking not only cigars but cigarettes as well.
Yeah,
But I've never heard them so interested in the process.
yeah.
You know, and
it's like wine. I mean, there are people. Everyone drinks wine, but there are people who really are very serious about it, and it becomes a hobby in terms of understanding the different. Not only the different grapes coming from the different regions, but even within a region, the different soil and tobacco is exactly cigar tobacco. Now, cigarettes are different.
I know,
but cigar tobacco is very, very similar to the issue of wine. So you could, one area of Nicaragua or Venezuela or wherever the tobacco is coming from, you could have two farms side by side, and then because of the soil differences, they taste different. So it does become a hobby.
Yeah, right. Yeah, it's quite unusual, as I said, but it's nice.
Actually, at one point, I was hoping that I could get into the cigar business, but it never worked out.
No?
Yeah.
Okay. What are the things that you are most grateful for?
My mother and father having told me in high school to get a job, as I mentioned to you, because I wouldn't be here sitting with you. Seriously, I would not be sitting here with you if it wasn't for the two of them. And also my wife. I mean, there's no question about that. There were probably many directions I realistically could have gone in to support myself, and I had, I had people, helping me. So that's one thing. Certainly, I can't underestimate this either. I think it's really important. Our mentors, really, really important. To the extent that we, really meet people. I'm sorry. I want to make sure I answer. Repeat the question to me again, Andre.
The things that you are most grateful for. Yeah.
Okay. Yeah. So my mentors. As I mentioned, the direction that I went in, to have had the opportunity to not only actually study with, but have the personal relationships with the 7, 8, 9, or 10 people who I, mentioned, both from Vanderbilt and NYU, who really, I think, they really had the ability to see who I was and what I could do. And there were some, obviously there were some hard times, as there are hard times for everyone.
All right.
Okay, different things, but there are hard times for everyone. And there were some people on both sides, NYU and Vanderbilt, who really helped me. They really did, and I'm extremely grateful for that. I definitely would not be here if that hadn't happened. So I think that to the extent that we have the opportunity to meet people, but also, it's interesting. If I had had a choice, and by that what I mean is, I had to take the help. There were 1 or 2 people at Vanderbilt. I didn't have any choice. I had to take the help they offered.
Okay.
And it was very difficult for me to do that. As I look back at it now, if I hadn't taken the help, I would not have been able to move ahead in the direction that I have. And there's no way that I would have been able to achieve what I did, not because of the help that they gave me per se, but because of what their role was in my life as time progressed. I don't know if I'm making that clear, but it's really important. There were 2 or 3 people who really understood where I was coming from and actually actively intervened to help me move along that path. And I actually had to reach out my hand to hold on to them, and it was very difficult to do personally, but I didn't have any choice in that moment. And what ended up happening was, of course, not only professionally, but we became personal friends, which then propelled me even further ahead. I'm very grateful for that. In a sense, I'm almost grateful for the various setbacks that I had that put me in that place of having to do that and not have any choice. I'm also extremely grateful to my wife. Without a doubt, I got to tell you, for 2 reasons. Number one, she's helped me see another side to the work we do.
Yeah.
Okay? There's no question about that. And still does, and still, if she overhears a conversation, she will, figuratively slap me on my head. She really will. And so never underestimate the role of your spouse in your relationship if they really care about you and believe in you. The other thing is, helping me see things from the patient's point of view. As I said, she's an artist. Frankly, she doesn't, now she has a different connotation to doctors, but when we first met, she didn't even want to continue I wouldn't say she didn't want to continue the relationship, but she was skeptical because she didn't want to go out with a doctor and the whole thing. But she's allowed me and helped me see things from the patient's point of view that I would not have seen otherwise.
Which is important.
Absolutely.
Very important.
There's no question about that. And I think I'm grateful also, as I said, but I want to emphasize that, for the things that did happen to me that actually were traumatic, because it put me in a place of having to ask for help that I otherwise would not have done. Now, maybe that's obviously, I'm talking, I'm opening myself up to understanding who I am, but it was difficult for me to ask for help. And there I am, the psychoanalyst and the psychotherapist, right? But it was hard. And I was in a place once or twice where I had no choice. And as it turns out, it was the best thing that ever happened to me. So I'm very grateful for that. And I'm also grateful for, the opportunities. It doesn't go without saying, and I have to give them credit too, and I've thought about this a lot. Both Vanderbilt and New York University Medical Center were absolutely extraordinary for me. They really were. They were really, really good to me. And I appreciated that very much.
Yeah. I think that we all reach some points in our lives when we need help, and I don't think that it's a shame to ask for help, whether it's help from your family, relatives, or professional help from a doctor. But I think it requires a lot of, self-awareness, if you know.
Yeah, and ability to put things in perspective.
Right.
Which I have to admit, sometimes it's hard. People say, well, it's a male thing. I don't know. All I know is that it was pretty difficult for me, and it put me in a place where I didn't have any choice.
Right.
And I had to, and I did, and as it turns out, it was the best thing that ever happened to me.
Yeah.
So.
And my last question for today for you is, what are the things that those who listen to this do really want to stick with them? To emphasize something, 1, 2, 3 things. The take-home message, if you want.
I think there are a couple. I can't order them, but let me, just what comes across in my head. First of all, number one, what we spent some time talking about with regard to intuition and creativity. It's extremely important not to give that up and to understand how important that is in our professional process. I mean, I don't know what's going to happen. None of us do clinically. But, you know, some people are able to give that up a little bit more readily than others. And to the people who have a hard time with it, I would say don't give it up. You know, whether you're someone who's going to be doing clinical work and or clinical research, it's extremely important. It really is. Do I have enough time for one?
Of course.
Okay, an illustration. I mentioned something in the very beginning about a couple of episodes that occurred while I was in psychoanalytic training. I'm not going to talk about all of them, obviously, but one. I had one, in addition, I was in what was referred to as the adult psychoanalytic training program, but as part of that, we had to do work with kids as well. And there was a child who was assigned to me, a young boy. He was 11 or 12 years old. I'm not going to go through the whole thing, obviously. But there were some things going on with him clinically as they were presented to me, both in the history and obviously in person by him and his parents, and I was working with him therapeutically, that actually I had supervisors at that point. And my supervisors were giving me, were telling me to approach this kid from a more traditional psychoanalytic perspective in terms of intervention and helping him and understanding him. And based on my experience obviously in medical school and all of the stuff that I had at Vanderbilt prior to going into NYU, I had, the only thing I can say is I had an itch at the back of my head. I really did. I thought there was something going on with this kid that just was not, the supervisors were not on top of it. They were telling me, it was all analytic and dynamic, and I can't remember the details, but we had some really bad arguments about it. And I really thought that there was something happening inside of his head. I really did. He had some classic signs of some organic, internal brain dysfunction. And for a while I let it go, and I asked the main supervisor a couple of times, can we at least have a discussion with the mother? Usually would be the one to bring him into the clinic. Can I have a discussion with his mother? And she said, no, you're going to scare her, a lot of stuff. And I just had a feeling, based again on my experiences in education up to that point from Vanderbilt, that something was going on with this kid that wasn't quite right. And I finally pulled the mother aside and I told her that I thought he needed to have a full neurologic evaluation. I told her that I didn't say specifically that I thought something was going on, like there might be a tumor. I did not say that. I simply said I wasn't sure. He needs to have a neurologic evaluation. I want you to take him to see, I got the name of a pediatric neurologist. And that was the last I saw of them. This goes way back. That was the last I saw of them for a while. Notice I used for a while. Fast forward now, at least 10 years. At least 10 years. I'm actually in a supermarket in Manhattan with my friend who was the chief financial officer for we were good friends. He worked for JP Morgan. We were shopping for dinner. We're picking up some things for dinner, and we were going to cook, and then our wives were coming back for dinner. And all of a sudden, I hear somebody call my name in the supermarket. And I'm thinking, I was doing clinical work at the time still, so oh God, I don't, you'll learn about that soon. Oh God, it's the mother. He had a brain tumor, and he had surgery. He's okay, and he was in college.
Wow. I don't think you'll ever forget that.
I stood there, this friend of mine, Lee, thought I was sick because I couldn't move. I couldn't move. every once in a while, I just want to make, for whatever reason, one of his favorite singers was Whitney Houston. And every once in a while, whenever I hear a Whitney Houston song, I flash back to that whole period of my life. It's extraordinary. So what I'm saying is the intuition thing is extremely important. I don't think that anything like that will ever happen to me again, but it happened once, and it's enough.
Yeah.
So that's one message. The other message, of course, is something that everybody hears all the time. If you think you really got a great idea, if you think, you want to do something and you want to accomplish something, do your best to try and not be sidetracked. It's really important. If it's important to you, I think that it's significant. I mean, particularly for those of us professionally, but even if not, and I'm not, if it's important for you, it's important enough to try and accomplish it. So, you hear all these stories. I mean, you have to live, you have to earn a living, you have to get your salary, if you can figure it out, don't let the dream die. I mean, try as much as you can. Because the reality is that, if you don't stick your neck out, you're never going to know. If you don't stick your neck out and try it, you're just never going to know. So on the cuff, those are the things that I think that are important. I mean, I would tell everybody to marry an artist, but that can't be done. I will say, however, that it is important to have a spouse who not only supports you, that goes without saying, and I don't mean that necessarily financially, but psychologically, but who can really contribute to understanding what it is you do. My experience is such that she's really brought an enormous wealth of clinical intervention for me. It's pretty amazing, actually. Particularly on the therapeutic level, individually. I'm very, very, very different now than what I used to be since before I met my wife. I'm very, very different. And I know that's a good thing because I've heard that from people.
Right.
So I can't think of anything else for the moment. I'm sure there are, but that's it.
Yeah. Well, thank you so much for coming here and for talking to me.
Thank you.
I am really sure that everyone who is going to listen to this episode will have a lot of things that they can put their mind to work. And I think, guys, you'll enjoy it, and see you next time.